St. Elizabeth's is an institution that sits on the outskirts of Boston in the Allston-Brighton community, and we're a 304-bed community tertiary teaching facility affiliated with Tufts Medical Center.
St. E's has evolved tremendously in the last decade. It retains characteristics of its community basis, but at the same time now has the quality and the academic rigor of a much more tertiary level university type institution. So it's a nice hybrid, I think.
We really offer hands-on training very early on to our fellows. So when I was training at actually a much larger hospital, what I found was that there were many layers of trainees who were older than I was, and I had to wait my turn. Whereas here, we throw you in the deep end and we kind of guide you along very quickly.
We also make sure that our fellows become independent, so by the end of their training we try to make sure that they are able to do cases on their own and also supervise, which allows the fellows not to only learn themselves but also to learn how to teach.
I've been here for about 6 years, and it's really nice being able to just walk up into a floor and I usually know who's working there. I'm able to kind of have more face-to-face contact with both my immediate colleagues as well as the nurses and the physicians. Everyone knows that you have like the best intentions, and just makes the workflow a lot smoother.
We very much have this sort of we're all in it together feel here, garnering forces and working collaboratively to sort of create something that's bigger and better, frankly, than what we might be surrounded by.
Boston is one of the most diverse cities in the country, economically, socially, culturally, and the fact that we have our world-class healthcare institutions, including St. Elizabeth's, within the footprint of the city is remarkable exposure for any student coming and participating in what Boston has to offer.
I came from Kansas City, Missouri, where there is a diverse population over here, but it's not comparable to Boston. And that's what I truly love about it. It doesn't matter what your religion is, what your culture, what your language, we're gonna treat you equally here in St. Elizabeth Medical Center.
If you treat the patients well and you do the right thing, the patients will follow, the referrals follow. I think St. Elizabeth's, because of the changes, because Stewart has grown, I think it all came together, the stars are aligned to deliver the kind of care that's different, that's unique, that you can't always get just out in a community setting or at a lot of other major health centers.
The people who really need care are the people who don't have money, the underserved. And that's what St. E's has provided for generations and will continue to provide in generations to come.